Mr. Andrews.
Thank you. I'd like to thank the witnesses for their testimony. Did not disappoint. It was very good for everybody. Thank you. Mr. Brill, on page 7 of your testimony, you cite a Boston College study that found that the financial crisis put the percentage of households at risk of not having sufficient post-retirement standard of living increased from 44% to 51%. So a lot of retired people in real trouble. I assume by at risk you mean that their incomes would either stagnate or not go up much, and their costs would go up by a lot. Is that what at risk means?
The trigger for being at risk in this study was that one's expected retirement income was more than 10 percentage points less than the targeted replacement rate.
Okay. Does it take cost into consideration at all? Cost of living?
It does, in the sense that it's considering income in real terms, not the nominal terms.
If someone's retirement cost went up by $6,000 because of increased out-of-pocket health care costs, do you think that would increase the number of senior households at risk?
Congressman Andrews, with regard to the Medicare issue, what I would note is the greatest concern that I have is the unsustainability of the current system.
Well, my greatest concern is the answer to my question. What I asked you was, would it put more senior households at risk if their costs went up by $6,000 a year?
I think that what's important is that people have an awareness of the situation that they're in. If they have the opportunity to save for that additional $6,000,
would they be aware that if their out-of-pocket went up by $6,000 a year, that they'd be in more trouble? Is that a fair statement?
Without warning?
Yeah.
Without warning, yes.
Well, with or without warning. I mean, say to somebody, here's some news. A few years from now, it's going to cost you $6,000 a year more to live. Does the warning really do them any good if they don't have the income?
If they have the opportunities to save, they can mitigate those concerns.
If they have the opportunity to save. But your own testimony says that the number of households who don't have the opportunity to save and therefore at risk grew from 44% to 51% because of existing economic conditions. So you think they're going to have much of an opportunity to overcome that?
I'd agree. It's important to strengthen our retirement security programs, encourage more people to save, make people more aware of the need to save, and facilitate through DC plans.
Now, on page 8 of your statement, you say Medicare, while recognized by some as an unsustainable program as currently constructed, lacks the bipartisan cooperation necessary to achieve meaningful savings. Is it true or false that the Affordable Care Act had $495 billion in Medicare savings in it?
I'm sorry, could you repeat the question?
The Affordable Care Act, signed by the President last year, had $495 billion in Medicare savings in it. Is that correct?
I believe that. I agree that's the...
And isn't it also correct that the Republican budget resolution in its baseline assumed those $495 billion in savings for future budgets? Is that correct?
I'm not aware.
The record will show that it is. I want to talk about meaningful savings in Medicare. What do you think about the idea of permitting the Medicare administration to negotiate the price of prescription drugs the way the VA does? There are projections, I think Mr. Richmond's organization projects that could save $24 billion a year. Is that something we should do?
I don't think that's a policy we should pursue.
Why not?
I'm concerned about setting the prices in pharmaceuticals because of the effect they may have on the development of new drugs.
Well, has the VA negotiating prices affected the development of new drugs?
The size of the VA market is smaller than the size of the retiree market.
So it is your position that we should have a law that says that the Medicare program should pay whatever the drug companies demand to be paid for prescription drugs?
That's not the current policy.
That's what the law says. They're prohibited from negotiating the drug prices, aren't they? What's the current policy?
The current policy with regard to Part B drugs is that Medicare reimburses at what's referred to as ASP plus 6, the average sales price as set by the market.
Is CMS allowed to negotiate the price of a Coumadin pill that it buys?
No, they're not.
Well, that sounds to me like the present deal is you got to pay whatever the industry demands. You think that's a good idea?
No, the current deal is that you're set to pay what the market demands, not what the industry sets.
What the market, but you can't participate in the market by being a purchaser. You have to wait and see what everybody else does? Well,
cur-
I just think that's a meaningful Medicare savings you don't seem to support. I yield back.
I thank you, gentlemen.